All right, we'll go ahead and get started here. I still see a few folks coming in, so um, we won't quite get to the questions here first off. So, Dana and Brooke, I'll introduce these two folks here in a minute. I did mute y'all, so just be aware of that when you need to chat. And so, but welcome to Upstream Benefits webinar on frequently asked questions. And so we have been doing a few webinars. I think this is, well, actually, this is our second webinar. The first one, some of you, I think, joined us there in that one as well. We talked about the benefits of learning and development, kind of our 5 key areas. We have that recorded, so if that's something that you want to take a look at or view, we certainly can send that link over to you as well. We spent a lot of time talking about our 5 key areas of learning and development, so it was a pretty good webinar. And if I cough, which I'm about to do here, I'm going to mute my thing, and so that way you don't hear my cough. And so maybe you're like me, it's pollen season. The pine trees have just absolutely opened up, and now we see these yellow clouds running around. So I apologize for that, and so you just get to commiserate with me. But today we are talking about frequently asked questions. So my team, which I'll introduce in a second, has spent a lot of time over the years answering questions for folks emailing in, calling in, and there's a pattern to those questions. We start to see the same questions over and over and over, and it's not necessarily because they're an easy question per se, but it's just something that folks deal with on a regular basis and ask us. And so what we've done is we've kind of dug in the archives and pulled out some of those frequently asked questions, and we just wanted to put a webinar together to kind of talk through some of them. Undoubtedly, we will not cover every question that we've ever received today, so these are just the questions that we get with regularity. In fact, I think I was talking with Dana earlier, and she was telling me just this morning that she answered most of these questions before lunchtime. So we get these questions frequently for sure, and that's what we want to go over today. If you have questions about the questions and the answers that we provide, then certainly you should notice the Q&A little button down below on your screen. And so if you open that up, you can certainly ask a question. We'll have time at the end of the presentation to go through some of those questions. If we run out of time, then we certainly will make sure that we answer your question directly by connecting with you. With that, let me introduce our 2 panelists today. And so you certainly are probably aware of these 2 ladies for sure. If you don't know, I'm the bald guy speaking, and that's me, Brian. And I'm an advisor here in our office. We've got Miss Brooke Roberts. She is our service coordinator. She's been with Upstream for a little over a year now and is phenomenal. She does a great job of coordinating service and making sure that questions get answered. Our whole team does a great job. And so she'll be speaking today about a handful of questions. I think she's up first. And then Dana, certainly you know Dana. You probably best know her as the renewal specialist. So she works with most of you on renewals, but she certainly helps with service and the like throughout the year. So very great team that we have. And so, and these ladies have spent a lot of time kind of curating answers for these questions to try to get to the heart of the matter for sure. And so they've been working hard on it. With that, I think Brooke is up first with a couple of questions, and then she'll turn it back over to me, and I may have a comment or two, and then we'll hear from Brooke with her questions, or excuse me, with Dana after Brooke with her questions. And then, like I said, we'll wrap up there with questions that you may have at the end. So with that, I turn it over to you, Miss Roberts. If you can get us started, I appreciate it. And so.
Okay, thanks, Brian. Hey, everybody. I'll jump right in to probably our most popular frequently asked question, which is, where is my ID card, or what is my subscriber ID number? And understandably so, this question comes up a lot because whenever you're at a doctor's office or you're trying to get a prescription filled, probably the first question that you're going to be asked is, do you have your insurance ID card? So we want to go through a couple different ways that an employee is able to get their ID card, and also just kind of updates on what we're seeing as far as trends and the direction that the ID cards seem to be going. So I'll cover in cases when the ID card may or may not be needed, how to show the employee so they can register an account with the insurance provider and actually be able to access information, not just their temporary ID card, but they'll actually be able to access information about their plan. Dana's going to go through some of that as well. And then I also want to make sure that the group administrators know how to access an ID card for a member and employee too, if needed. So the first one, as far as in our digital age, we're kind of noticing a trend, which is with the ID cards. A lot of insurance providers are starting to have everything be online. So because of that, and because medical records are all digital now too, an ID card may or may not be needed when you get to the doctor's office or to the pharmacy. And oftentimes, if you just have your social security number or your date of birth, the provider will be able to look up whatever information they need on your coverage just with those two pieces of info. But having an ID card when it's available is certainly something that we encourage, and we want to be able to show an employee how they can register for their account and be able to access a temporary ID card, whether they've lost the one that they have or they're waiting on one to arrive maybe in the mail. And so I'm going to actually ask Dana to jump into our employee navigator, which is what you and the employees would use when finding some info on your enrollment, to be able to show you where to have the employee go for a way to register their account. If you'll notice when you log in, this is going to be the home screen that the HR users will see. And from here, Dana and I actually recently found a pretty cool little way to get back to if you want to get to your home page. So we're going to actually jump over to where it says Penny Lane and switch to our employee page. So from this page, which is what all of the employees will see when they log in, we're going to go ahead and head over to enrollment summary. And on the enrollment summary page, it'll list out all of the insurances that the employee is currently enrolled in. For our example and where to get registered for an account and then be able to actually download an ID card, we're going to use the medical plan as our example and go to see full details. On the see full details page, you'll actually be able to find out quite a lot of information about the plan. Dana's going to cover that a little bit later in our presentation, but if you'll just scroll down for me a little ways there, Dana, on the screen, the employee will be able to see all of this, but towards the bottom of the screen, there'll be a box that is titled Find a Doctor Drug Facility Search. And depending on which insurance provider they are looking to create an account, the instructions for that specific provider will be in this box, and it's going to include a couple different links. So for Blue Cross Blue Shield, you'll notice this plan was a Blue Cross Blue Shield plan, and with Blue Cross, it's called Blue Connect. Anyone that has a United Healthcare plan, it's called MyUHC. So with Blue Connect, you've got two options. With MyUHC, you do as well to register the account. An employee can either log into the website, the Blue Connect website, and once they're registered for that Blue Connect account, they'll be able to download an ID card there. Or back to the digital age that we're in, if an employee prefers, they can actually download a Blue Connect mobile app from their smartphones. And you wouldn't even have to, in that case, if they would rather have the ID card just on their phone, when they're at the doctor's office or the pharmacy, they would be able to just show them the information right on their phone. So either option would certainly work. And that's where you could get the links at any point you need to there. The last option, so we'll switch back off of Employee Navigator, but the last option too that we want to make sure that any of our group administrators know is that your login to the insurance provider site actually gives you access to all of the employees that are enrolled in plans. And if you go to an employee, or as the insurance provider refers to it, a member's profile, there's an option in the member's profile where you can actually download an ID card there. And usually you can download the ID card that can either be printed off or it can be emailed to the employee. So they have it one of two ways there. Now, that's pretty much going to sum up for where is my ID card, but we'll jump into some of our other frequently asked questions, which has to do with an employee changing or needing to make changes, or perhaps you needing to make changes to their enrollment. And there's a few different scenarios where this would occur. We'll go through each one of them individually, but just to highlight which ones we're going to touch on here, we're going to walk through if you need to add a new hire, if the employee has a change in their enrollment, and usually that's in a time where they're outside of their new hire period or they're outside of the annual open enrollment period, but something changes with their benefit needs, then it would probably fall into a category of a qualifying life event. So we'll want to walk through how to process a qualifying life event. And then we also want to make sure that you know how to terminate an employee. So from here, if we could jump back into Employee Navigator, Dana. I'm going to head back to our HR user homepage. And from our HR user homepage, you'll actually find there's a few quick links on this page if you scroll down about halfway, one of which is where we're going to add an employee. So the second one down there, thank you, Dana. When she opens it, it brings you to the screen for whenever you're going to add a new hire or a new member to your team. Could be that they're brand new. It could be that they are switching from part-time to full-time, or it could be where they're just newly eligible for benefits. So not any of those scenarios, you're going to want to put in certain information for the employee, their demographics. And what we're going to start with here is the first and last name and the social security number. As she enters in the information, everything's going to be filled out, and it'll give us permission to hit next to take us to the next screen. And we're going to definitely just highlight the ones that you are required to fill out, but you're certainly willing to complete as much information as you'd like about the employee. So we're going to need to include required fields of sex. So we'll make him, yep, John Deere will be male. We'll need the date of birth. Whatever state they're currently residing in, which in most cases for anyone around this area will be North Carolina. And then we will need to include an email. Whatever email you have, if they have a work email or a personal email, either one will work, but then you'll just choose which type it is as well. So Dana, that drop down, thank you. It'll show work or personal. We'll hit next again. On this screen, the required fields are you are going to need to put in the day that the employee is going to start working or their hire date. The next required field will be the class. So on that drop-down menu, you're going to pick whether or not the employee is full-time, part-time, or an owner. If they're eligible for benefits, they're going to be full-time, so FT for full-time staff. The payroll group is also required, and when you drop down there, the two options, you'll just go with the staff payroll group option. And then for salary, salary is typically optional unless your group offers life or disability plans. So in the case where life and disability plans are offered, you do need to go ahead and put in a salary. And you could certainly put it in even if you don't offer that, just so that there's record of it there. After the salary, though, the rest of the screen there is not required, so you could go ahead and hit next. And then the reason the email is so important is whichever email you decide to put in, just make sure that you send the registration email to the employee, because in that registration email that the employee gets, it will include the instructions for how to register for Employee Navigator. And then also once they get registered for Employee Navigator, it'll walk them through how to complete their enrollment, and they'll be able to choose their benefits. Once you go ahead and send the email, the last screen will just be, you'll hit finished, and that employee will be officially added to Employee Navigator. So from there, what we're going to do, that's basically how you would add a new employee. But let's say that employee or another employee on the team needs to change something with their enrollment because they had a qualifying life event. Most common qualifying life events that we see are certainly a member having a baby, or the spouse has an open enrollment, and because the spouse's open enrollment happened, something changed where maybe the other spouse now needs to update or drop their coverage. So we're gonna use Sally Field, I think, as our employee. So from the HR user homepage, you can look up an employee by just typing in their name into the search field like Dana just did. And the qualifying life event can actually be done by the employee. However, if you wanted to do it for the employee, from their administrative page, we're going to go to the employee's homepage again, which is on the right-hand side of the screen, about 3/4 of the way down. And the employee homepage will take us to what the employee sees when they log into Employee Navigator. To process a life event, you'll actually just go to the square that says Life Events. And we'll go ahead and walk through how to do this. So in the scenario of adding coverage or dropping coverage, you're going to be given, I don't know, a dozen or so different options there for each one. And what we always just recommend is whatever is most closely related to the situation that that particular employee is in or going through, that's what you would choose. In our example today, we're going to say that Sally had a baby, so we're going to go ahead and pick newborn child, and we want to add coverage for the newborn. So Employee Navigator will prompt for the information that it needs. The first piece of information will be when the baby was born, or the date of the event originated also happens to be the baby's birthday or the day that the baby was born. So what do you think, Dana? We'll use today or somewhere this week maybe? And then also we'll need to go ahead and capture the baby's name and some of the other demographic information. So if you hit add a new dependent, you'll want to put in required fields will be first and last name, the relationship to you, which would be child, or to Sally would be child, and then the sex of the baby, male or female. It is going to ask you for the date of birth again, so you do have to put that in again. With a newborn, if you have the Social Security, if the employee has a Social Security number, definitely have them go ahead and put it in, or if you happen to have it on their behalf, put it in. If not, the enrollment for the newborn can be processed without a Social Security number. We can add it later, but it's ideal to go ahead and put it in as soon as you have it. And from this screen, once you hit save, then you'll be able to choose whatever you want to have the baby enrolled in. And because this particular group has medical and dental, we definitely would recommend that the baby be included on the medical plan, but it would be completely optional as to whether or not the parent wanted to include the child on the dental plan, because a newborn probably is not going to go to the dentist in the first year of their life. But once you pick the plans you want to enroll them in, you'll hit save. And then I believe we are confirmed at that point. So when Employee Navigator gives you confirmation the dependent has been saved, just of note, what happens on our end is we actually get a notification that Sally has added a dependent, and we know that now we need to process that with the appropriate insurance carrier so that the baby is now added to her plan. And once that's processed and we get confirmation from the insurance provider, we'll let the HR user or you guys know with an email and a report for confirmation. Actually, we do that for new hires as well, and we'll do it for when we terminate an employee, and that's where we'll head next. So to terminate an employee, you as an HR user will be the one that will have to do this. So you'll log into your HR user homepage, and you'll go ahead and use the search bar to write in the employee that you want to terminate, which I think we were going to do Sally again. So we'll use Sally again for termination. So on her admin page that you as the HR user can see, you'll have over on the right-hand side, the menu there under actions will give you an option to terminate employment. So once you've hit that link, it's going to bring you up to a screen where it's going to ask you to verify Sally's address. So whatever the current address is, if the current address is in there already, no action is required on this screen. But certainly if you need to update it, you are able to here. And when you go to the next screen, you're going to get a couple more questions about termination. The first is going to be the termination date, or the last date that the employee's at work. So we'll put that in as next Friday. And then you're going to need to give a reason. So they give us a handful of reasons to choose from. Employee Navigator does. The most common that we use or that we see used is one of the first two, voluntary termination or involuntary termination. But definitely whatever applies to that individual employee's situation and circumstance or closest to it, you can click and then you'll be able to hit next. And it's going to ask for confirmation. So continue. And then again, it'll confirm that it's been terminated in Employee Navigator. We'll get a notification to process it with the carriers and go ahead and email you the report once that's complete. But that's how you would terminate someone. And the last little tidbit that I want to add on the questions or what we've just kind of gone through in terms of the changes that you can process with Employee Navigator is that we do have an HR user guide that gives some step-by-step on how to go through each of these changes and some of what Dana's going to go over here in just a minute. So if anybody would like a copy of the HR user guide, I think Brian was going to drop a link in the Q&A box, or we can certainly email it to you after the webinar today. But on that note, I'm going to turn it back over to Brian.
Thank you, Brooke. Hopefully everybody can see the link that I put there in the Q&A. In the webinar, our chat feature is disabled except for amongst us, and the HR link would not do us much good. That's why we wanted to get it into your hands. But if that's certainly something, the HR user guide that you would like to take a look at, we also do a great job of sharing that guide whenever folks have questions. So we not only answer the question, but we also always provide a guide because it's important to us to help you know how to self-service. For the longest time, I think I got time for a story, so I'll give you a story. For the longest time, right, I would go into the stores, let's say Home Depot or Lowe's because that's my favorite stores, and you start seeing self-service checkouts pop up, and I'm like, what? That's not right. There's jobs are leaving, and I got to check my own self out. Well, sometimes I found that checking my own self out is faster or better or more convenient. And so we have self-service options within Employee Navigator. We're always going to be your first source, but sometimes you're looking for maybe a simple answer in a hurry. And so we can answer it the question, but sometimes we may be a little bit slower than what you need. And so the HR user guide does that for you. and those self-service options. Just a couple things, and then I'll turn it over to Dana for a couple questions that she is going to go through. But couple of the things that Brooke had mentioned, I just want to reiterate is don't let not having an insurance card hold up your going to the doctor. And so sometimes we've heard folks where they're like, well, I can't get to the doctor because I don't have an ID card. Don't let that hold you up. Get in there, get the service that you need. They'll figure out the insurance card. They're good at doing that in their office. They can look you up. They can find it. They just don't trust us. That's why they always want us to bring our card, because they don't trust us, because we never know what we're talking about, and so that's why they say the card. But don't let that hold you up. Another couple things that she said as well, where to get the cards, make sure that you are registered with the services that are provided. Blue Cross Blue Shield North Carolina, for example, uses Blue Connect, which is a really great service, and so you can get everything you need there as well. And the last thing I was going to say is, just to reiterate, is when employees are going to make changes, it's good that they are making the change. Sometimes we have HR users that go in and make the changes for the employees. We know that employees always come to the HR person, that point of contact, and ask the questions, and sometimes it's just faster to jump in there and make those changes for the employee. But I would encourage you to still make the employee go into the system, log in, and make those changes, because Employee Navigator is also our compliance model, right? And so everything that happens in Employee Navigator drives our compliance. And so if you make a change, Mr. or Mrs. HR person, it's going to reflect that you made that change, not the employee. So you can see that there's a difference in who makes the change and when. And we've had employees come back and say, well, I didn't make that change. Well, you're right, you didn't. This person did. And so it's hard then to follow up with whose wishes were where. So it's not a lazy thing. It's not a push it back on them thing. It's a compliance thing to have them go in and make those changes. Obviously, terms and additions are going to be on the responsibility of the HR user, but those changes, we'd like to see the employees make those for sure. And so with that, I'll shut up, and then I will turn it over to Miss Dana. She's got a couple questions for us to go through as well. Dana?
Forgot to unmute myself. Thanks, Brian, and thank you, Brooke. Hi, guys. And thank you so much for taking an hour out of your day today to be with us and kind of get a refresher and or just learn some new things about Employee Navigator. Like Brian, I believe, mentioned in the beginning of the presentation, this system is our baby. This is what we use to communicate with you all, and it's pretty robust. There's a lot of stuff going on in this system, but hopefully we'll get all your questions answered, at least the most frequently ones today. This is a huge one. Money, cost. How much is it going to cost me as an employee? And also how much is it going to cost the employer? I think we get this almost once a day, maybe twice. And there are a few ways to view how much the cost will be. And I'm going to show you how to view it in your benefits guide. A benefits guide is a PDF document that we create for all of our groups, and we upload it in Employee Navigator for y'all. You could view it, the employees can view it at any time throughout the year, and I'm going to show you how to find that. But this guide is super helpful for especially the HR users to show potential candidates. So when you're hiring somebody new and you don't want to put them in the system yet, you could view the cost because the breakdown is right in the benefits guide for you. And then also people ask, like we just did a qualifying life event for a baby, people want to know how much it is. Well, you can certainly, like you just saw Brooke do, put in the cost, put in the baby, and you can see how much it's going to cost them, or the spouse if you get married or whatnot, even before you click Save and Continue. So I'm going to show you how to do that through an open enrollment screen. And then also that brings me to my new hire and annual open enrollment. This is going to be the best way for new hires and then already established employees, when they go through their annual open renewal enrollments, it'll show what the cost is going to be. It's broken down per page on those screens. Alrighty. So let's jump back into Employee Navigator. So I am going to go back to the HR over here employee page. There's a couple different ways you could view your benefits guide. You could view it in your document library section, or right here, which is under your compliance document, the benefits guide and notices. So once you click on it, on our computers, it downloads and then a PDF opens up, and I already have it open up here that I'm going to show you in another tab. So this is about 3 or 4 pages into the benefits guide, and it's going to show you a breakdown of what the premiums are going to be monthly. Okay, most y'all on this call are, most of you are going to have are groups that have their medical premiums based off someone's age. So what you would want to do is determine the age. If I'm a 40-year-old employee, I'm going to look at this and see $495.54. That's how much the total premium is going to cost. Again, this is monthly. But then you also want to know, okay, well, what is the employer contribution? In this case, it's going to show up here too. In this benefits guide, the company contributes 100% towards the employee premium. So the employer is responsible for this amount. The employer is responsible for this amount. The employee, 0. But employee wants to add their dependent, let's say their spouse who's 45. Well, that gives you the $559.91 cost right here. Or if they have a child, they could look at how under the age of 15, that's how much it's going to be, $296.63. These are shown in monthly cost, and it shows the employee contribution right above. Okay. The second and third options, I'm going to go back into Employee Navigator here, and I'm going to go ahead and walk us through, which most of you probably already seen me do this plenty of times if you've been on open enrollment meetings with me, of what it's going to look like with Suzanne Summers going through open enrollment. So just like Brooke showed you how to hire a new hire, how to add a new hire, the new hire gets the registration email, and this is what they're going to see. Once they register and log in and create an account, they're going to see the new hire enrollment. I'm going to show you how to add the dependent, and then what it's going to cost with or without the dependent through these steps. Whether you're a new hire enrollment or you're already established and you're in your annual renewal open enrollment, the process is the exact same. You're going to have a green start button, and you're going to get started. Now, I've already pre-populated the address and a dependent in here, guys, because I wanted just for sake of the timing of this presentation. So I just want to verify everything correct is in here, and then I'll hit save and continue. And I've added an address, save and continue. And I did, like I said, I added a dependent already for the sake of the timing of the presentation. But if you want to add another dependent, let's say I want to add my child, go ahead and add a dependent, and I'll go ahead and do it. Bobby, what's my last name? Summers. Male. 23. Oopsie. Okay, so now I've got 2 dependents in here. I'm going to hit save and continue. So that's how you add a dependent. Just because I can't stress enough, just because you add a dependent on that screen doesn't mean that they're enrolled in your plan. You'll see right here, so you add the dependent, you come to this screen, and now you're going to see the cost change, okay? So right now I'm only enrolling in myself. The company contributes 100%, so I am responsible for $0 per pay period. If I want to see what it costs to add my spouse only, then I'm just going to check on his name, and you see the cost change down below. This is calculated. Employee Navigator calculates what it is per pay based off the payroll, the number of payroll deductions that you all provided us. Some of you have paid 12 months, 24, 26 times a year. So this is it's automatically going to calculate it for you. Now you want to add your child and see how much that's going to be. Cost goes up a little bit more per pay. Okay. This is such a common question we get even before open enrollment comes to us. And yes, we could send folks your benefits guide and they can look at it that way. But again, the benefits guide will show you monthly. This is the easiest way for folks to look at how much it's going to cost me per pay. Let them go through open enrollment and view it that way. But don't worry about you all doing the calculations on that end. All right, the next question we get quite often is, what are my benefits? It sounds kind of silly, but yes, people enroll in benefits and have no idea what they are. So I'm going to show you more of what, how to find your benefits if you are going through enrollment again. And there's a few ways to do it. One of them are some PDF documents, our benefits highlight, and SBC, which stands for Summary Benefits of Coverage, during open enrollment, and I'll show you that. Brooke kind of already went through where to see that, but I'll remind y'all. Insurance carrier websites, I'll dig down into this as well when we get to that point in Employee Navigator. And then the benefits guide that we just had open, okay? So I'm going to go back into Navigator here, and I'm already in open enrollment, right? I'm on my screen. There's a few places on this screen you could view your benefits. Over here, you'll see under Helpful Resources, you'll see Benefit Highlights or SBC. You click on either one of them. PDF's going to open up for you, and I already have one open up in another tab. Let me blow that up a little bit here. And this is going to give you a more detailed explanation, even with an Employee Navigator, of what your benefits are, because it'll actually break down for, how many visits you have for physical therapy, chiropractic, things like that. But this is a great document. You could print it off, share it with your spouse if they're going through open enrollment at the same time. It has all your copays, your deductibles, prescription copays, co-insurance, everything you really need to know about what your benefits coverage looks like. Okay. The next place here in Employee Navigator is in this Details button right here. So you click on the Details button, it'll show, just like we saw with Brooke when she was reviewing how to register, you'll see a list, just like the benefits highlight too, of your outline of your benefits coverage. The only thing it doesn't really go into detail is, okay, how many chiropractic visits do I get, right? So that would be in your benefits highlight. But this is really plenty of information for them to really determine if they wanted to enroll in the plan or not. Then scroll all the way down, and I'm going to drill it into everyone's head again, is the importance of creating an account with, whether you're with Blue Cross or United, Delta, Dental, whoever, the insurance carriers, to create an account with the carriers themselves. Employee Navigator is not Blue Cross or not Delta Dental, not United. Either is upstream. We don't have all the information that we could provide to the member, mostly, and they won't even provide it to us, mostly due to HIPAA reasons. So when folks call in and say, we've had this happen before, and my claim isn't getting paid, or what have I met towards my deductible, I have no idea, and they will not tell us, unfortunately. When you create an account with the insurance carriers, you'll be able to log in anytime throughout the year. You could view your benefits, of course, your coverage, and you can also view your claims, the history. You could view what you've met towards your deductible. If you have a $3,000 deductible, it'll say you've met 15 out of the 3,000. What you've met towards your max out of pocket. It'll have all your explanation of benefits there for you. It'll show you how to register for telehealth. It'll have more information that you could probably even imagine. And also that app, whether you're with United or Blue, it's very important to download that as well. I don't know why I'm like one of the other million people in this world. I just don't carry my insurance. It's sitting on my desk here, and I don't know why I never carry it with me, but I have the app. And I have the account too, so I've had to pull up the app before and show them at the doctor's office what my coverage is or what my subscriber ID is and group policy number. That about wraps it up. Let me go ahead and get out of here. Go back over here. Oh, one last one is the benefits guide, guys. I forgot to show you that one. So the benefits guide, you could get to it a couple different ways, like I showed you before, under your compliance library document. I'm going to go ahead and open it up. I already have it open from before. And it's on the same page with the cost star. Now, this is a very, very brief snippet of your plans, but this is really, really the bread and butter of what people want to know, what my copay is when I go to the doctor, a deductible, and really the prescription drug coverage. So again, this is great to give a potential new candidate, a new hire, if they're thinking of coming on board, because it has the cost here, it has what the employer contribution is, and then it has just a really brief breakdown. Okay, if you go to the doctor, $25, a specialist $50. So everything's right here for them, which is very, very helpful. Again, mostly for new hires, but again, you could use it anytime throughout the year. Okay, we save the best for last, y'all. What is the reporting, right? So this system, if you all haven't realized this, now it's very, very robust. You could probably run just about any report you could think of in Employee Navigator. They have a report for just about everything. What I'm going to really show you today is the pre-built reports that we have created. The one that I'm going to really focus on is the payroll deduction report. And then I'm also going to show you how to save this so you could log in anytime and go to your favorite templates and look at your report and see it if you need it at any time. Okay, let's go ahead back to Employee Navigator. I'm going to go back to our HR homepage. Again, up here, go to your HR username or HR name and just click on Home. There are two ways to get to the reporting section in Employee Navigator. You could click on the Reports tab up here, or right down here in the Quick Links, it's just one less click. You could just click on the Manage Saved Report templates. Okay, so I'm going to go ahead and click on this template right here. Now, under All Saved Templates, you have three little categories here. Okay, the My Templates will display the templates that you have saved on your own. I didn't save any report templates on my own as a Penny Lane HR user, but these are reports that you could go in and save a report on your own right here. Shared with Me is the main payroll deduction report. The Shared with Me is what I'm going to show you in a second, but that shows all the templates that have been created by another user and shared with you. And by user, I mean us at Upstream, the broker, that we have created and shared it with all of our HR users. Or some companies have multiple HR users. And so let's say Sally created a report, a census report or a demographic report that she wants to share with, Megan, the other HR user. So you could share reports within your company as well. And then favorites is reports that you are going to favorite as your favorite. These have all been designated as a favorite by clicking that star icon. Okay, so I'm going to go back here, Shared with Me. This payroll deduction report, this is the report that we have put together with pre-filled items for you that we think this is really all you need to know what's going to cost me and my employee. Okay. If you don't see this star here, if it's not under your favorites, go ahead and star it. So now it's saved under my favorites. So next time I log in, I just have to click the favorites and it's sitting right here. But I'm going to go ahead and show you, I'm going to click on this report. And this, when I say we've already pre-built it, is if you can see here, we've got a couple fields, employee and enrollment, okay? There are dozens and dozens and dozens of fields we can choose to run on this report. Now, we didn't choose all the dozens of things. We just chose some basic demographic information that we think we need, and then certain enrollment information that we think was important to share with you all for the deduction report. So, excuse me, the one thing that's super important is over here under the effective date. So you could certainly run it today and see what your payroll deductions are for today. But let's say you're a group that may be up for renewal in April and you want to see what your new deductions will be in the next, 2 weeks or whatever that is. So you could change it to April. So just keep in mind that effective date is very important. The effective date is not when the effective date is going to show you when the benefits are effective, essentially. Okay. So I'm going to go ahead and click View. And you can see, forgot we trimmed some folks here. Report got shorter. This is our payroll deduction report. You could download it. You could save it as an Excel spreadsheet as well. It'll break out into the employee and the employer cost. Again, this is the payroll deduction report. So this is going to be based off the number of payrolls you provided us. This is what Ryan and I send to a lot of the groups at renewal or new groups coming on board. This is exactly what I send y'all. And you could view this at any time if you save it as your favorite. Okay, and reporting, folks, you could spend hours. I could spend probably hours of reviewing some different reporting options for you. If you have any questions on specific reports that you may want, you could create your own report. That's almost like a whole nother webinar that we may think of doing down the road. Just let me know, and I'd be happy to help you as well. But that about wraps it up for today as far as our most frequently asked questions that we've been receiving over the last few years. But with that being said, we really appreciate you all taking the time to spend with us today, and I'm going to pass it on back to Brian to see if there's any questions that have come about.
Yeah, thank you very much. I appreciate that, Dana.
You're welcome.
Brooke. We've got a few minutes here before we get to 2, which is our stopping time. And so if you've got any questions that you may have, please just drop that in the Q&A there. I don't see in there in the moment, but I'll kind of wrap us up, and if any pop in, and then I'll come back to that. So a couple things I just want to reiterate or highlight that Dana went through as well. The BEN guide is, the benefits guide is, we call it BEN guide, but the benefits guide is really important for that new hire because you can't put them really in Employee Navigator because they're not hired. You're maybe looking to hire them, but sharing that benefits guide with them in PDF form is kind of a static document that's easily handed over. So that's where we see that mostly used, and obviously you can answer kind of what is my cost if I jump in, kind of a quick snapshot there. But you have to accomplish a little math, and if you're like me, you may be math challenged, and so if that's the case, and this person's going to be a hire for you, go ahead and get them Employee Navigator. Now, every single group's got kind of a different, probationary period of time where employee has to wait before things are available. So obviously, everybody's got different probationary periods. Some as much as 90 days, some as soon as the first day of hire. So realistically, you just want to get them in there as soon as possible so they can kind of have time to go through the system, especially if you're a quick turnaround. So your probationary period is less than 30 days. You want to get that individual in there and give them a chance to go through everything. Just because you put them in Employee Navigator doesn't necessarily mean that they go through in the next 30 seconds and then we enroll them and then boom, you're paying for it. They're still adhering to the probationary period, so it's not going to rush them to start. It's just going to give them an opportunity to kind of go through things. Dana also mentioned too, and we see this sometimes causing big problems where folks go in and they go through a step or two to add a dependent, but the dependent, there's never a confirmation, or you saw those little bubbles where she was checking to show different costs based on who's enrolling. A lot of times folks will forget to check the bubble to enroll someone. So you really want to make sure when you get to the end of it, when it gives you that confirmation, go through that confirmation Employee Navigator to see who's enrolled, who's not, and everything's reflected. We just had this happen a week ago of somebody that thought they added their child. They didn't. They're at the doctor's office going, what do you mean I'm not covered? Well, you never got them all the way through, so something you want to be very, very careful of. Employee Navigator, Dana also mentioned Employee Navigator is not Blue Cross Blue Shield. So back in the day, right, when I first got in this business, we had paper applications. I'm sure y'all probably remember paper applications. Well, Employee Navigator is our 2024 paper application. And so it's where we collect the data and we make sure that everything's correct and we share the data with folks. But then we take that information and we move that into the particular provider, whether it's Blue Cross, United Healthcare, or whoever your insurance provider is. So we do have humans on the background administering some of these things. And so other than that, I think that was it. Oh, the last thing I'd say is if there's a report that maybe you're needing every so often or you think is important, we would love to connect with you and talk through that report and see if that's something we can create on our side and share with all of our groups and maybe favorite as well. And so so something to think about. I do have a question that came in here. Let me just read it to you. Who would we submit our payroll reports to? I haven't been doing that, but it's good to know we can. Good question. And so sometimes folks will pass their payroll reports over to their payroll provider. Sometimes, most of the time, probably what happens are the HR users takes the data from the payroll report and puts it into their payroll system. For example, here at Upstream, we don't have a payroll provider. We do payroll in-house. So really, we're taking that data and putting it into our payroll provider ourselves. I think most of you are probably doing that. There are some cases where that report is kind of, sent on to someone else at the payroll place to put it in as well. It really depends on kind of what your relationship is with your payroll provider, what they're willing to do for you. Some payroll providers are rather large, and they're probably going to go, huh, when you send them that report. But you certainly could do that for sure. Other than that, I don't see anything else, and so I'll kind of wrap us up here. This webinar is recorded, and so those of you that have joined us today, you'll get a copy of this as well. And so we appreciate your time, and I certainly appreciate these ladies going through and working on these questions. Again, these weren't all the questions that we get on a regular basis. We just knew that we could only fill a little less than an hour, so that's what we gave. So if you have other questions, even the questions that you think are dumb and you think you're wasting our time, which they're not dumb and you're not wasting our time. That's why we get paid the big bucks. And so we'll be more than happy to take your questions. We're very thankful for our clients. We're very thankful for the opportunity to serve y'all, and we appreciate that. With that, I appreciate it. Thank you very much for attending, and we'll have another webinar next month on another topic, and so we hope you tune in. Other than that, you enjoy the rest of your Tuesday. Thank you, everybody. Have a wonderful rest of your day.
Thanks, everyone.
Bye. Thanks, y'all.